TSCPC and UCP in advanced glaucomas. So laser treatment, as we all know, in advanced glaucomas is cyclodestructive procedure, and continuous wave cytophotocoagulation has ab externo and ab interno, and then we have the micropulse cytophotocoagulation. So cytophotocoagulation, it reduces the aqueous production by destruction of the ciliary epithelium, and the techniques are transscleral, transpupillary, and endolaser. Indications are failure of multiple filtering surgeries, primary procedures to elevate pain in neovascular glaucoma with poor visual potential, painful blind eye, and surgery not appropriate. Diode laser transscleral cytophotocoagulation, widely used method of ciliary body ablation, 40 to 80% success rate, traditionally reserved for advanced glaucomas, not amenable to other treatment, and the continuous wave transclearance cytophotocoagulation induces coagulation necrosis, causing a long-term ciliary atrophy. And the micropulse transscleral cytophotocoagulation causes IOP lowering with better safety profiles. So that is the instrument that you see out there. It's a gentler form of cytophotocoagulation and appears to work very much like the eye drop pilocarpine, no restrictions on one's activities either, and low risk profile. And that is how it is applied in both the quadrants. So the technique is you put the patient in a supine position with a retrobulbar block, and the G probe is inspected for any damage in the event of none. Place it on the limbus. Mild pressure is applied to ensure that the foot plate is in contact with the ocular surface, and sparing the 3 and 9 o'clock positions, the rest of the area is circumferentially treated with half the probe with gap in between. And we use a 810 nanometer diode laser at the duration of 2000 ms and 2000 watts, milliwatts power setting. Each quadrant can accommodate about 5 to 6 spots, and to avoid thermal injury to the conjunctiva and underlying tissues, constant wetting of the ocular surface is necessary. And after the procedure, drop of prednisolone acetate and atropine are administered. Steroids, cycloplegics, and anti-glaucoma medications should be tapered and stopped in relation to the response. So the outcomes, as found by various studies that have been done, is that it's a non-contact cytophotocoagulation in comparison to the diode laser contact cytophotocoagulation. The continuous wave is definitely much better than the earlier varieties, and the micropulse TSCPC is reported to have achieved good efficacy in relation to safety for severe refractory glaucomas. So at a glance, the micropulse transclearance cytophotocoagulation has proven to be safe, effective, and reliable approach for lowering intraocular pressure, and that is actually the method of choice, and it has been used now also for glaucomas which are not really visually potentially threatening, but also for patients who do have some amount of visual activity, because it can actually give a better result than the previous ones. Then we'll move on to the ultrasound ciliaroplasty. This is a novel device employing high-intensity focused ultrasound for the coagulation of the ciliary body, with the aim of achieving selective coagulation of the ciliary body while sparing the adjacent structures. So it's a high-intensity focused ultrasound in a non-invasive procedure that delivers high-concentration sound waves to the ciliary body, reducing aqueous production and increasing the outflow, thereby lowering intraocular pressure. We did a study on this, and the results of therapeutic ultrasound for refractory glaucoma over a year. 38 eyes were treated with a mean follow-up period of about 18 months. The mean fall in intraocular pressure was about 38.6%. Analysis for 3 success criteria, that is, success varied between 74% to 78% in the mean follow-up time. Complications occurred in 8.4%, including phthisis in 0.6% and persistent hypotony in 1.5%. There was no mean loss of visual acuity, and the therapeutic ultrasound appears to be safe and effective for the treatment of refractory glaucomas. And I'm going to show you a small video of how the procedure is done. So the ultrasound ciliaroplasty, basically it's pretty simple. That's the machine that comes from the AIOC2022, and that's the docking system that it has. So this is the inner part of the docking system. You just have to put it into that plastic thing. And following that, I'll just you feed in your details that are there in the eye, and you select the eye, and that's how it has to be placed, absolutely 180 degrees. That's the docking system, and that's how the vacuum builds up. You test it for patency first, that there is no leak there, and then place it on the eye, concentric to the limbus. That's how it is. And the coupling cone actually has to be filled with BSS or saline, so that that acts as the transmitter of the ultrasound waves. And then you actually, this internal docking system can be turned according to the horizontal meridian in which you are applying the ultrasound. And that's the maximum fluid that you can give. There are levels, and the foot switch has to be pressed. And that's the ultrasound being applied in the different quadrants that you see. It's like a Wi-Fi sign that you see out there. And there's a gap of 20 seconds between each application of the ultrasound, and there you turn it and apply it in the other quadrant. And that's it basically. So thank you very much for